The origins of occupational and environmental diseases. The chemical manufacturing industry had its origins in Germany and Switzerland in the late 19th and early 20th centuries. In the first decades of the 20th century, the industry spread to England, and then in the years before World War II it expanded to North America, Australia, and Japan. Since the 1950s, the industry has spread globally. Beginning early in the 20th century, toxic chemicals began for the first time to move in substantial quantities from industrial facilities out into the general environment. This was a direct result of the rise and global spread of the chemical manufacturing industry and the introduction of new and untested chemicals into consumer products. Widespread contamination of air, water, and soil with toxic chemicals also began to be seen at that time. The rapid growth of industrial chemical manufacture has resulted in a wealth of new consumer products and technological advances, many of which have improved our lives and made us safer. But unfortunately, in the haste of production, new, untested, and potentially dangerous chemicals have been incorporated into thousands of household items. Furthermore, older toxins, such as lead and asbestos that were placed in consumer products many years ago continue to be responsible for hazardous exposures in homes and communities all around the world. The result has been growth of environmentally caused diseases, including lead poisoning and chemically induced cancers. Environmentally caused diseases were first spotted in industrial workers, who because of their work were the first to experience heavy exposure to chemicals in the workplace. Disease in chemical workers has followed the chemical manufacturing industry almost from its beginnings. Occupational lead poisoning is perhaps the oldest known occupational disease. It was first reported in Roman times among lead miners and smelter workers. The clinical symptoms of lead poisoning were described in great detail in the early 1700s by Bernardino Ramazzini, an Italian physician, considered today to be the father of occupational medicine. One of the earliest reports of occupational disease caused by synthetic chemicals was an 1898 report of an outbreak of bladder cancer among chemical workers in Switzerland who were occupationally exposed to synthetic aniline dyes, one of the first classes of man-made chemicals. As the chemical and dye manufacturing industry spread globally, bladder cancer followed, first to England and North America and then more broadly. The disease typically made its appearance in a country about 20 years after the start of dye manufacture. Synthetic aniline dyes have now been confirmed to be the cause of bladder cancer, and these chemicals are classified today as proven human carcinogens by the International Agency for Research on Cancer, IARC, the cancer agency of the World Health Organization. The dyes have been banned in many countries. The typical incubation, or latency, period for bladder cancer in persons exposed to synthetic aniline dyes has been found to be about 18 to 22 years, which explains the typical 20-year lag between the start of chemical manufacture in a country and the first appearance of bladder cancer in workers. Leukemia caused by occupational exposure to the solvent benzene was another early consequence of chemical manufacture. Like bladder cancer caused by synthetic aniline dyes, benzene-induced leukemia followed the chemical manufacturing industry as it spread internationally. Benzene has also been classified as a proven human carcinogen. Asbestos exposure in World War II shipbuilders and in construction workers in countries around the world has been shown to be another cause of occupational cancer and is responsible for lung cancer and mesothelioma, a cancer of the lining of the lungs specific to asbestos exposure. Asbestos has been classified as a proven human carcinogen by the UC. Numerous synthetic chemicals, many of them still in wide use today, have been found to cause cancer in workers and are now classified by the UC as either proven or probable human carcinogens. Other synthetic chemicals have been found to cause diseases of the brain and nervous system, reproductive system, endocrine organs, and immune systems of chemical workers. Copyright Academy House www.academy.house